Hello, my name is Ramnik Mathur. I work at Chelsea Investments NHS Trust, and today I'm going to talk about diarrhea and vomiting in children, which is also known as acute gastroenteritis. So, what causes diarrhea and vomiting? Most of the time, gastroenteritis is caused by viruses. Occasionally, it may be due to a bacterial infection like food poisoning or returning travelers, and this may require different investigation and treatment, but 95 to 99% of the cases are viral in origin. So it's okay to keep a child at home, and the way you can help the child at home will be, the main thing is to asking them to drink plenty of fluids. If it's a baby, then if they're breastfed or formula fed, they should be offered small but frequent feeds. With older children, often small and frequent drinks should be advised. Avoid fruit juices and fizzy drinks if possible. They sometimes can make the diarrhea worse as they are a bit acidic. Consider using an oral dehydration drink such as Diarrhoea, which is called oral rehydration solution. This comes as a powder to be dissolved in water, and instructions are usually on the packet. It helps replace electrolytes your child is losing as well as the water. As with other drinks, give your child a small quantity every few minutes. We usually advise 5 mils every 5 minutes, which is a teaspoon. Your child can try eating as soon as they feel like it. Do not force them to eat. Start with plain starchy food such as bread, rice, or pasta. But don't worry if your child doesn't want to eat for a while. Drinking is much more important. Anti-diarrhea and anti-vomiting medicines are not recommended for children. What are the signs of dehydration? That's very important to look out for. So the following signs, your child may be getting dehydrated. So dry lips and tongue, pale or blotchy looking skin, cold hands and feet, drowsiness, that is being excessively sleepy, passing much less urine than usual, no tears when your child cries, unusually fast breathing or pulse. So these are the signs you need to look for, because dehydration can be a serious problem and your child needs to see a doctor without delay. Now, when you should seek help. So most cases of gastroenteritis get better within 5 days or less and can be treated at home. Sometimes though, your child may need medical help. So you should talk to your GP if the problem continues for more than 5 days, or your child has a lot of vomiting but no diarrhea, or there is a mucus which is like slime in the poo. You should bring your child to A&E if you notice signs of dehydration, you see any blood in the poo or vomit, your child becomes very sleepy and hard to arouse, your child is distressed and inconsolable, or if the vomit goes dark green. Do not worry about green poo, it's the vomit. If that's green, then you should bring your child to A&E. Now, how is gastroenteritis treated? So as long as your child can manage to keep down some fluids, either rehydration solution or ordinary drinks, they will usually get better by themselves. Also, if you do not have ORS, if you dilute apple juice 50% with water, that is also a very good solution for the children. When a child really can't keep anything down at all and is getting dehydrated, they may need to stay in the hospital to get fluids in another way. So this can be through either a nasogastric tube, which is a soft plastic tube through the nostril down into the stomach, or an intravenous drip so that fluid can go directly into the bloodstream. Your child's immune system will always fight the infection successfully. We just need to make sure they don't get too dehydrated in the meantime. What tests are needed? Usually none at all. Sometimes though, your doctor may want some samples, which might include a urine sample to make sure your child doesn't have a urine infection instead of gastroenteritis. Usually they just have vomiting in these cases but no diarrhea. They may ask for a stool sample, which is a poo sample, if your child has traveled abroad, so they can have an unusual bug which needs special treatment, or if the diarrhea is prolonged for a long time. Sometimes we do blood tests, but only if the symptoms are really severe for the child to need a drip. How can you stop the gastroenteritis spreading to yourself or other children? Always wash your hands and make sure your child washes their hands after using the toilet and before eating or handling the food. While your child is unwell, disinfect the toilet or potty after every use. Keep your child away from nursery or school for 48 hours after the symptoms have gone. If you need more information, you can visit NHS UK/conditions/rotavirus gastroenteritis. Rotavirus is one of the most common viruses that causes gastroenteritis. Too many children are vaccinated against it. The other website is patient.co.uk/health/gastroenteritis in children, and there you can find latest guidelines. Thank you.